Few people talk about this, but there are tests that many doctors continue to order for people over 70 years old that can cause more harm than good. These tests seem harmless and are part of many people's medical routine. The problem is that, as age advances, the body changes, metabolism changes, and the risk of complications also increases. Still, the healthcare system keeps repeating protocols designed for younger people without considering that what helps at 50 may be dangerous at 75. Today, I want to talk to you about the exams that deserve to be reconsidered after 70 years of age. This is a serious subject because understanding what truly provides benefit and what only causes anxiety, misdiagnosis, and unnecessary treatments can literally save lives. Many people undergo tests just because the doctor ordered them, without knowing if they make sense for their age, physical condition, or quality of life. And when it comes to the elderly, what matters is not doing all possible tests, but rather choosing the ones that will genuinely bring safety and well-being. One of the most requested tests is the prostate antigen test, known as PSA. It helps identify possible changes related to prostate cancer. In younger men, this test can be useful, but after 70, it often loses its relevance. This is because prostate cancer tends to grow very slowly and, in many older men, never causes problems. Still, the test result can lead to a biopsy, which is an invasive and painful procedure. After the biopsy, many end up receiving aggressive treatments, such as surgery and radiotherapy, which carry serious risks of infection, bleeding, incontinence, and impotence. All of this to treat something that, most of the time, would never cause real symptoms during the rest of their lives. I have seen many cases of men who took the PSA test routinely, had a slightly abnormal result, and then underwent a series of exams and treatments that only brought suffering. Therefore, this test should be evaluated carefully. In many cases, observing the patient and monitoring calmly is a much safer decision than acting hastily. Another very common exam is colonoscopy, used to detect polyps and prevent colon cancer. It is an important exam, no doubt, but it may also become unnecessary after 75 years of age, especially if the person has previously had normal results. At this age, the risk of complications during colonoscopy increases significantly. There are higher chances of intestinal perforation, bleeding, and reactions to anesthesia. And since colon cancer usually takes many years to develop, the benefit of repeating the exam in asymptomatic elderly individuals without a family history is small. Many people believe that the more tests they undergo, the better their health control will be. But that's not always true. In the case of colonoscopy, the most important thing is to assess whether the person truly has risk factors and whether the result will change the medical approach. Because it's pointless to detect something that won't develop in time to cause problems, and it also puts the patient at risk with the procedure. Women also need to be cautious about excessive testing. Mammography, for example, is essential between the ages of 40 and 69, but after that age, it can cause more harm than good. The reason is similar to that of PSA testing. The exam can detect small changes, often in tumors that would never cause symptoms. However, when a result is abnormal, the patient undergoes a series of biopsies, surgeries, and treatments that affect quality of life without increasing lifespan. This is what we call overdiagnosis, and it is more common than you might think. With aging, the main goal of medicine should be to preserve quality of life, rather than seeking diseases at any cost. In a healthy 80-year-old woman, a minimal change detected by mammography can lead to months of worry, repeated tests, and even unnecessary surgeries. All of this causes anxiety, pain, and discomfort. In many cases, calmly observing and maintaining medical follow-up is the most balanced approach. Another important point is controlling diabetes in the elderly. Many doctors still insist on maintaining very low glucose targets as if the patient were young. However, an elderly person's body does not react the same way. Very aggressive treatment to lower blood sugar can have the opposite effect, causing sharp drops in blood glucose levels. This leads to dizziness, fainting, falls, and even hospitalizations. In older adults, the goal is not to have perfect glucose levels, but to keep them within safe ranges, avoiding both excess and deficiency. It is also common to see elderly people undergoing unnecessary imaging tests. CT scans, MRIs, and even whole body scans are performed just as a precaution. But the problem is that these images often show small changes that pose no real threat. However, this leads to investigations, biopsies, and procedures that carry more risks than benefits. A clear example is an elderly person who has a CT scan to evaluate mild pain, and the test reveals a small nodule in the lung. Even if this nodule is harmless, the patient begins to live in fear, undergoes new tests, faces biopsies, and often unnecessary treatments. This causes anxiety, suffering, and can even reduce life expectancy. These examples show that the most important thing is not to eliminate all tests, but to know which ones are truly worthwhile. After 70 years of age, each person is unique. Chronological age should not be the only factor considered. What matters is overall health, lifestyle, and quality of life expectancy. An active elderly person with good nutrition and no serious illnesses can benefit from some preventive tests. On the other hand, a fragile person with chronic diseases and limitations may experience more harm than benefit from invasive tests. Therefore, it is essential that decisions are made calmly and through dialogue. The most important thing is to understand that the patient has the right to participate in decisions about their own health. No test should be performed without a clear explanation of the risks and benefits. Modern medicine values what is called individualized care. That is, each case should be evaluated according to that person's conditions and priorities. After 70, the focus should be on maintaining well-being, balance, and autonomy. This includes a balanced diet, light physical activity, quality sleep, and regular checkups with the doctor. These actions provide real and proven benefits for the heart, brain, and the entire body. When it comes to exams, less can be more. Instead of searching for diseases that may never cause problems, it is better to invest in habits that strengthen the body and prevent complications. Walking every day, maintaining a healthy weight, avoiding excess salt and alcohol, caring for the mind, and having good social relationships are actions that truly extend life and improve the quality of the years. I always say that information is power. When you understand the purpose of each test and what it truly represents, you gain more control over your own health. This is how you avoid unnecessary procedures, aggressive treatments, and manage to age with more peace of mind and awareness. If you are over 70 years old or caring for someone who is, talk to a trusted doctor. Ask if the tests being requested will actually change any course of action, if the risks are worth it, and if there are less invasive alternatives. This dialogue is essential to avoid excesses and ensure that healthcare is done in an intelligent and humane way. I am Eddie Rodriguez, and this is the EDU Health Tips channel. If this content helped you, share it with someone who needs to hear it. Like the video, subscribe, and activate the bell so you don't miss the next tips. Accurate information saves lives, and taking care of health consciously is the first step to living longer and better. See you next time.